Heart failure. Important notes. 1. By the law of Laplace, left ventricular, LV, wall stress is directly proportional to intracavitary pressure and chamber radius and inversely proportional to wall thickness. Ventricular hypertrophy is therefore an adaptive mechanism that serves to reduce ventricular wall stress. Myocardial hypertrophy and remodeling proceed in different patterns based on the timing and nature of the provocative stimulus. When the primary stimulus is pressure overload, as in aortic stenosis or hypertension, an increase in wall stress during ventricular systole triggers the addition of new myofibrils in parallel, leading to wall thickening at the expense of chamber size, in a pattern of concentric hypertrophy. When the primary stimulus is volume overload, as in chronic mitral regurgitation, increased wall stress during ventricular diastole triggers the replication of sarcomeres in series, elongation of myocytes, and ventricular cavity dilatation, in a pattern of eccentric hypertrophy. Therefore, although both chronic pressure and volume overload are associated with a compensatory increase in LV mass, the pattern of hypertrophy is distinct in each case. Using echocardiography, concentric hypertrophy can be distinguished from eccentric hypertrophy visually, or on the basis of the ratio between wall thickness and the LV internal diameter during diastole, i.e., the relative wall thickness equals 2x posterior wall thickness / LV internal dimension. A relative wall thickness less than 0.45 suggests eccentric hypertrophy, whereas a higher ratio is more consistent with concentric hypertrophy. Left ventricular mass increases in response to chronic pressure or volume overload or secondary to primary myocardial disease. With predominant pressure overload, as in aortic stenosis, there is an increase in mass with little change in chamber volume, concentric hypertrophy. In contrast, chronic volume overload, as in aortic or mitral regurgitation, or primary dilated cardiomyopathy, results in ventricular dilatation with only a small increase in wall thickness, eccentric hypertrophy. In chronic regurgitant disease, there is usually an increased stroke volume in the compensated state, whereas in cardiomyopathy there is impaired systolic function and a reduced stroke volume.